Hi, we are here tonight in this Zoom room seeking a repeal to Florida's statute 768.21 subsection 8, the Wrongful Death Act. We're asking that Senate Bill 262 and 560 be heard by the Senate, which would then open the door for House Bill 6011 and 6039 to be heard in the House. Tonight, you will hear testimony from the people in the state of Florida who are the families of victims. These bills are highly politicized because the opposition stands to lose money, while the people here stand to gain the right to hold medical practitioners accountable for gross and grossly negligent errors that cause the death of their loved ones. It is no secret in America that many politicians prioritize corporations over the welfare of the people. This month marks the 5th year in a row that I have requested change in this law, and many others have come before me. In these 5 years, the Senate has yet to make room for the people's voice on this cause of ending the Wrongful Death Act. Over these past years, Florida Medical Rights Association has mainly served as a support group for the community of victims' families who suffered wrongful death. We have listened and comforted one another for our own healing. But most of us, and most of the people sitting here before you tonight, have never, ever been heard in any official capacity, not in a courtroom, not by a state department, not in Tallahassee. Tonight, we've come together to give recorded testimony as families of victims take the next step in their healing and raise their voices. I will be sending this video to all of you legislators, asking that for this time of this video, and that you watch this video, that you put the politics aside and truly hear how this bad law is affecting the people only in the state of Florida, and how it's causing an alarming amount of medical errors to go unaccounted for, and how the people you represent, your constituents and your neighbors, are suffering needlessly. We, the people, ask that you, the legislators, listen and favor what is right and moral and responsible over the politics that have been used too long to keep this law in place. And before we begin, I am recording. I'd like to ask if anybody objects to me recording them tonight. So there is no objection. I'd also like to ask if anyone here objects me sharing the recording in areas such as YouTube, news media outlets, and of course to send to legislators. Okay, so there's no objection. So we're going to begin. I will call on everyone. We will each take 3 minutes. I will warn you when you have 1 minute left and when you have 30 seconds left, and ask that you respectfully allow us to move on to the next one after that time. I'm going to begin with Sabrina. You have 3 minutes.
Hi, I'm Sabrina, and I'm here to tell the story on what happened to my father, a 62-year-old self-sufficient veteran of the United States Navy. He woke up on a Saturday with pain. He had swelling, bruising, hot to the touch, and he was unable to walk. He told me he needed to get to the hospital ER. So I helped my father get to the ER, and we educated staff upon arrival of his past medical history, which included blood clot, and that my father was currently taking a blood thinner. The staff documented these things in his chart. We asked 9 times for staff to do an ultrasound to check my father's leg to see if he had a blood clot, and they did every request. They decided that my dad needed bed rest. So for the following Sunday, Monday, Tuesday, Wednesday, and Thursday, my father sat on bed rest. We texted, talked, and he sent me videos and pictures of his leg. On that Thursday, 19 minutes after we spoke, my father stood up. He was about to be discharged, and he died. The hospital declined to do an autopsy, so I paid for one privately. And when I got the results back, it showed that the autopsy doctor pulled out a 9-inch long blood clot from my father's chest. It originated in his left leg and it traveled to his chest, killing him. Leaving him on bed rest made it worse. And the fact they documented he had a past medical history of blood and they never checked for it, they were fully aware of this. Advised by the autopsy doctor to seek out an attorney because this doctor is a danger to the people. After calling 8 lawyers and being asked if my father was married, which I told them no, and they asked me how old I am, and I told them 30, I realized that due to Florida Statute 768.21, subsection 8, there was nothing I could do to hold the doctor at fault accountable. Since then, I have filed with ACA, the Agency for Healthcare Administration, and they have found the hospital at fault. This is public on their website. In the meantime, the hospital is still billing my father's estate for unpaid medical bills, and no attorney will help me or take my case because my dad was single and I am over 24. Yet it's public on the ACA website that they have been found at fault for my father's death. So I'm personally asking you to please hear these bills and so we can get this law changed. I'm in the medical field. I took an oath, and I believe it's important that we live up to that oath as medical professionals. Thank you.
Thank you, Sabrina. I'm sorry for your loss. Jerry, would you like to speak next for, there's a timer. Somebody said a timer. Oh, that's mine. I didn't know it's gonna make a noise. I'm sorry. Jerry, would you like to go next? Okay, I don't think he's hearing us. So Mary Jo, you are up on the screen. Would you go next?
Sure.
Okay, I'm gonna set the timer at 3 minutes. I'll let you know at 1 minute and at 30 seconds. Thank you.
Ready? Hi there, I'm Mary Jo Kane Reese, and I'm here on behalf of my father. My dad had a stroke on October 10th, 2019. Dad was rushed to Holmes Regional. Can we take a break?
Yes, you want me to come back to you?
Yes, please.
Okay, I'm sorry. Joseph Wyman, do you want to go ahead and give us a shot for 3 minutes?
Okay. My name is Joseph Wyman. I'm a resident of Brevard County, Florida. I was a caregiver for my mother for 14 years. She went into the local hospital for a minor procedure of putting a feeding tube port in to supplement her nutrition. The hospital put her on a cardiac monitor. When she went in there, she didn't have a lot of cardiac problems, but due to her age, they put her on a cardiac monitor and they lost telemetry. It was supposed to be an in and out procedure of just a couple days hospital stay. They never to this day have located the data from the cardiac monitor. They held up the surgery for 8 days, at which time they told me she developed sepsis at the IV site and she wasn't going to make it. Did we want to just dump her in the hospice, or what did they want us to do with her? She was still alive. They were treating her like a corpse already. So we did bring her home. She lived for 6 days with the help of hospice. Now, this was the hospice that operates out of that hospital. They asked us, please pursue this. They said this is gross negligence on the part of the hospital that they actually work for. So only then did I find out, after she passed, that she was pre-kill. I'm way above the age of 25 and she was divorced. So there was no recourse at all. There was no way to hold these people accountable. I thank the legislators, for giving the time to listen to us, and please help us overturn this barbaric law and bring these butchers to justice. Thank you.
Thank you very much, Joseph, for your testimony. I really appreciate it. Dana Stevens, would you like to go next?
Sure.
I will set the clock and I will notify you at 1 minute and also at 30 seconds.
Okay. Is the lighting okay? You think it's all right? Okay. All right. So tell me when.
Go ahead.
Okay. Hi, my name is Dana Stevens. I want to take a second to thank you for giving me the opportunity to speak. My mother's name was Rebecca Stevens. She was a mother of 2 daughters, grandmother to 5 grandsons. My mother's grandchildren meant everything to her. She was 59 years old. She suffered from COPD and had severe hearing loss, which kept her from holding a job. But we would laugh because we called her a stay-at-home grandmother. My mother lived with us for 13 years. My oldest is 13, so he had grandma with us his entire life. My mother took care of the house and kids while my husband and I worked full time. A few months before my mother's death, we were given full custody of my 13-year-old twin nephews. It was a lot, but we made it work. My mother was admitted to Advent Health on September 27th, 2021, last year, with a COPD flare-up. She tested positive for COVID. My mother was extremely neglected, starved of oxygen for 6 days. We were forced into palliative care, general inpatient hospice care, where we would find out that my mother had absolutely no rights. My mother was scared and in critical condition. I was told by 15 attorneys that I would have to go to the courts to get an injunction so the hospital would release her to me. I ran out of time and my mother was given a death sentence. On October 22nd at 1:00 p.m., my mother was euthanized right in front of me. These doctors and this hospital killed my mother. I was completely traumatized after making phone call after phone call to about 50 attorneys who all asked me the same questions. Was your mother married? Did she have children under the age of 24? And this was the first time I learned about Florida's free pill law. This law was allegedly intended to protect consumers from high healthcare costs, but in reality, the only outcome that this law has revealed is the amount of physicians and hospitals who know that they have this safety net. No accountability has proven to result in more negligence, discrepancies, and carelessness. Not only does this law free physicians from accountability, it also takes away patient rights. COVID-19 has put a spotlight on just how broken our healthcare system really is. Deadly medical errors are the 3rd leading cause of death in the US, according to the CDC. This law leaves more than half of the population in the state unprotected from medical errors. If doctors do not have to disclose this free pill law with a patient, when a patient signs an informed consent form, the patient is not really getting informed consent.
Thank you.
End this free pill law.
Thank you so much. Thank you. Good job. Good job. Mary Jo, do you want to try again or do you still need a break?
I have a question.
Yes.
Yeah, you know what? I'll go after the next person.
Okay, you're good.
Thank you, hon.
That's okay. Yes, Dana?
Did I go over my 3 minutes?
Only by like 2 seconds. You're good.
Okay. Thank you.
Okay, so Crystal, are you still with us? Crystal ending in 6162. Okay, probably trying to figure out how to unmute. Kelly. Kelly, phone number ending in 780.
Yes.
Okay, there you are. Would you like to go ahead and speak for 3 minutes now?
Yes.
I will notify you at 1 minute and also at 30 seconds.
Okay. My big brother, Michael Patrick Ryan, Irish Catholic, born August 15th, 1954, died in the SICU unit at Shands Hospital while waiting for a liver transplant. A native Floridian, diehard Florida Gator, self-made millionaire, he designed and built the Grand Floridian Hotel at Disney World, as well as the Animal Kingdom Lodge. Very active, golfer, gardener, a badass guitar player, great grandfather, father, best big brother to me, my siblings. He was admitted on June 27th, 2021 to the Children's Hospital with advanced liver disease. He was going to wait there for an available liver. He was optimistic and looking forward to a new lease on life with a new liver. He was able to walk, eat solid food, use the bathroom without assistance, and talk. The morning of Monday, June 29th, 2021, the doctors discovered a blood clot in his right leg. He was administered a heparin IV drip. A few hours later, he jumped from his bed, which set off his bed alarm, sprinted to the bathroom, and passed a very large amount of bright red blood. When I arrived at 9 a.m. that morning, there were 7 hospital staff members standing around his bed. I knew something had gone terribly wrong. He was quickly transported to the underground tunnel to the SICU unit in the cancer hospital, the liver transplant ward. For the next 35 days, he never got out of bed. I talked to many ICU nurses and all said, you never give a person with advanced liver disease a heparin drip, never. In his 196 pages of medical records, there are numerous missing pages. This day consisted of 17 pages, all missing. He endured one excruciating procedure after another to stop his internal bleeding. A standard procedure in the ICU unit is a chest tube. I saw a nurse student accidentally knock the tube out. They tried to reinsert it, but they couldn't give him pain meds because his blood pressure was so low. I watched him plead and beg while they tried to reinsert the tube. They strapped his hands to the bed. I watched his eyes roll to the back of his head repeatedly as he suffered unbearable pain, crying out in agony. 2 hours later, they intubated him. 13 days later, they extubated him. That was the last time we ever talked. Early the next morning, he coded 4 times for 10 minutes. He was intubated again for 22 days. On August 1st, they extubated him, gave him a tracheotomy, but he continued to bleed. During the early hours of August 3rd, 2021, Michael experienced a massive brain hemorrhage. This removed any chance to receive a liver transplant. When the Catholic priest came in to give him his last rites, the priest hesitated. He'd seen Michael before. We'd all prayed together. He looked at the nurse, at me, then Michael, and exclaimed, "He's so young. I'll come back later." She looked up at him and said, "No, you need to do this now." At 3:17 p.m. on August 3rd, 2021, he was removed from life support and died. And that's it. Thank you.
Thank you so much for sharing your story and for having it be heard.
I'm gonna go.
Okay, it's okay. This is very, very tough stuff. Thank you. That was very brave. Do you want me to pass you by again, Mary Jo?
Yeah.
Okay.
Thank you.
Ties, would you like to go next for 3 minutes?
Of course. Thank you so much. Thank you for the opportunity to speak. My name is Tice Williams. I am the daughter of Deborah Crawford. My mother was a 70-year-old woman who was full of life. She was a mother, a grandmother, a friend. She was a vet. She served our country. When she became a victim to medical malpractice on December 23rd, 2021. She died from hospital-acquired urosepsis because the doctors and other hospital staff, they failed to run a simple urinalysis test despite multiple physical signs indicating the need for such tests. We brought this to the attention of doctors and nurses, but they were inattentive and they were understaffed. By the time the infection was caught, it was too late. It had turned septic. Her kidneys shut down. Her lungs, they filled with fluid. Her blood pressure dropped. She took her last breaths and left behind all of us that love her so much. Our hearts are shattered. My heart is bleeding. We have so much grief, our pain, we have agony. My mother beat ovarian cancer, and then she died at the hands of neglectful hospital staff, and that adds so much trauma to our pain. Please repeal these bills. Put a stop to doctors and other hospital staff who engage in incompetent and unethical behavior. I'm an attorney myself. I have to maintain my license. I have to uphold the highest of ethical and professional standards. There are repercussions for not adhering to them. Doctors and hospital staff, they have the fate of one's life in their hands, and they should be held accountable. They should not get away with murder. Please repeal these bills. Thank you so much for listening.
You did a great job, and you were under time. Thank you so much for sharing. I know how hard that is. Thank you.
Thank you.
Gosh, it's hard to know who to call on next. Nicole Jones? You may have to unmute. I've muted everybody kind of in the background. I think there you are. Okay, let me see if I can just look really quick at the whole gallery.
Here I go. Can you hear me now?
Oh, yep, there you are. Okay.
Good. Okay. Okay, I'll do this.
Got it.
Okay. First, I'd like to thank you. It's taken me 3 years to be heard by anybody. And my son was 28. And boy, this is harder than I thought. I'm sorry. I'm just going to talk. We went to the emergency room one day because he was having problems urinating. Now, Landon had been diagnosed with an eating disorder, and that happened back in 2015. Now, he was on a regular program, and this child needed to eat like every 30 minutes, you know, because just of the way his body would break everything down. So when we're in the emergency room, his physician had given him a direct procedure pass, I believe is what they called it. So when he would go in to get fluids, to get hydrated, that he wouldn't have to go through all the, you know, and get admitted and do all the testing and things all over again, because it had been established and he was on a program. So I'm with him. And he drove down there. I mean, we're good. And he said, okay, Mom, they're going to do this. And they promised me, you know, no, he doesn't need to be admitted. So I went on to work and I said, well, give Craig a call and he'll come pick you up. He said, okay. So I get off work at about 10 o'clock that night and I come home, there's no Landon. I said, Craig, what's going on? Where's Landon? He said, I haven't heard from him. Get in my car, haul back to the hospital. Couldn't find him. Took me 30 minutes to find him. They had put restraints on him, taken him up and admitted him because he hadn't eaten for 12 hours. His potassium, which was fine when we got there, had dropped. So the nurse told me they were going to, you know, get his potassium level up and I could come pick him up tomorrow, the next day after 12. By the time I got there the next day, they had already started one unauthorized procedure that neither one of us knew anything about. And this procedure, the nurse attempted to put a midline guide wire, and it broke off in his arm and they left it. Following that procedure, just about an hour, and we weren't aware of any of these. We didn't sign, he didn't sign, there was no verbal anything. The second procedure, he attempted to place a central IV in the right femoral vein. And this is a peg, if y'all have ever seen it, about 1.5 inches big, okay? It took up half of his arm. They actually use a drill. Now, this is only the second time this physician had done this. And they did it in his room. And when I walked in there, there was an instruction booklet in the windowsill. There were 2 nurses in there, one cute little Oriental girl. And she said, you know, this is only the second time he ever did this. And, you know, you don't know what to do. And then there was a third procedure. And this is when a physician went in, and he was doing a probe, and he punctured his artery. So this poor boy went from not being able to pee to having all these things done to him. And he went this entire 5 days with no food, nothing. Everything I have is documented, because the day after Landon passed, we went back to the hospital and we just demanded his medical records. They said, no, we don't have a death certificate. We said, we're not going anyplace. Long story short, about 3 hours later, 600 pages. I said, I don't need from childbirth. They said, no, this is 1 week. In July, 2 months later, I requested his medical records. I got 90 pages.
We're over time.
Oh,
But we were
see,
gonna,
I can't do it.
it's okay.
I can't do it because there's so much more. I knew that was going to happen.
You
So-
are fine, and in our next group, we're gonna put you up first, and we're gonna hear your whole story with.
So can you scratch me? Can you scratch me off this and I'll do it next week?
No, we're gonna keep this is for testimony, and I think it's important for legislators to be able to hear what you have been through, even though we're trying to make room for everyone.
Yeah.
I think it's important, and I think that, you know, in a nutshell, you lost your son to wrongful death, and
Well, and misdiagnosis, you know, because here again, we had to do an autopsy because he was flagged in Florida. We had to bring him from California. And Landon actually died of COPD. And all the medications that they gave him, I mean, oxycodone, Percocet, fentanyl, Toradol, Ativan, they slowed the breathing. They killed him.
And so
Well,
we're gonna spend some time in more of a support group setting with you. Thank you so much for sharing that. Don't be so really hard stuff. This is really hard stuff. This is the tough stuff, and you did a really great job. I'm gonna call on Jerry next. I've seen you pop in and out. It looks like you were having some connection problems, but it seems like you're connected now. So I'm gonna set the clock for you for 3 minutes, and hopefully I'll maintain the connection.
Okay. Do you have me now?
I have you now.
Okay. My name is Jerry Popra. I have a podcast out there under Jerry Popra, and Generation recorded it. It's an hour and a half on the things that have gone wrong with my daughter's death. And yes, it falls under the Wrongful Death Act. Under the Wrongful Death Act, we were told by 8 attorneys that my daughter had no human life value. So how do you take that? Because they wouldn't take the case, although it's clear and evident that the hospital allowed an unlicensed nurse to do rounds for a doctor. And in doing rounds, she mixed up admitting records, and my daughter got a heart drug that wasn't ordered for her, and nor was it meant for her. They overdosed her and put her into an irreversible coma that killed her. Then they changed and altered all the medical records to make it look like she needed the drug. And in doing all the changes, what they did is they left in other patients' names showing that a heart that did things that couldn't possibly happen to other people. It's just not possible. We've had medical experts verify the fact that this is all fraud. The legal nurse that was hired by the state attorney general when we went there verified that it was all fraud. Although under the Wrongful Death Act, my daughter had no human life value. So what they did is they rejected the case, leaving me to face a gauntlet of at least 15 attorneys. Even the judge was paid off in this case to throw the case. He dismissed the case under prejudice, stating that because you had an attorney that filed and dropped the case, it shortened your statute of limitations. This does not exist in a court of law or in the law books anywhere. And yet the judge got away with it. So we just said he erred. Although we needed an attorney to take it, but under the Wrongful Death Act, there's not enough money for either me or the attorney the way we're told. It would cost over $100,000 to bring this case. So the law is so inherently wrong that it allows a sloppy kill. And that's the exact words the medical legal nurse used when she said it's all fraud. So we have a case that we can't get anywhere, although I went to HIPAA. HIPAA had budget cuts and wouldn't take on the case. Also, we went to ACA. ACA helped the hospital cover it up. Also, I went to the Attorney General's office that changed the legal nurse's report that said it's all fraud, and they said there was no fraud. So now we even had a investigator that said he quit his job over this because he was so frustrated. So where do you go with it? How do you get justice? The law is so inherently wrong that it makes you make a choice between taking the law into your own hands to get justice or fight it like I have done for 20 years. There's no justice. We are writing a book. We will name them. I've named them in my podcast, and each time I will name more of them. They will face this as I get their jobs because I have 2 letters into the governor's office right now for a demand justice letter. And the 3rd letter will demand that justice because I cannot deal with a law that is corrupt. The corruption is no place. And are these people higher than the law? That's the question. So the political question is, should the lobbyists be allowed to pay these politicians to vote in their protections for these doctors? And in those protections, we lose. The law is supposed to be set up for the people, by the people, not for the politicians and not for the hospitals. The hospital is wrong. And we were told that it's a 400-bed hospital. They will not close that hospital for you or your daughter.
Thank you, Jerry. Are you good?
I'm good. Did I say enough?
You said enough, and Jerry has a podcast where he talks a lot more about these things. Do you want to give everyone your podcast, how they can find you real quick before we?
Under YouTube, just type in Jerry Perpera. It'll come up under Generations. It's an hour and a half, and it talks about some of the corruption that's involved with trying to get a case heard in this sort of situation. The law is wrong and needs to be changed, and that's my point to the politicians.
What was the last name? Jerry?
P-U-R-P-U-R-A.
Thank you.
Thank you.
Thank you, Jerry. I appreciate you. And I know how hard that is. The Rivera family, I know between you, I've seen a couple, I saw you just pop on, Miguel. I know you have one person to speak. Can you want to call on that person? I kind of lost track of which person you wanted to represent the family.
Oh, hey, how you doing, Melody and everybody? I contacted my sister.
I'm
Two
here.
of my sisters. I think they were on earlier, from what I understand, but I wasn't able to
Catherine,
get on. I don't know if they said anything.
looks like Catherine's here, so Catherine, are you going to speak for the family?
No, it was supposed to be my sister Rosie, but I don't know where she's at right now.
Okay. Do you guys want to wait and I'll move on?
Yeah.
You know, when
Yeah,
Okay.
thank you.
Okay.
I'll send her a text right now so she could get on.
Okay, no problem. If Heather,
Hi, I'm Heather.
start your clock.
My father back in June was diagnosed with colon cancer outside of the colon. They couldn't stage it. They said they only found precancerous cells. Let's see, and in June or in July, he ended up doing chemo and radiation. The tumor markers went down significantly, so that was a really good sign. Months and months went by. We were trying to get a hold of doctors. Nobody got a hold of us because he was supposed to get surgery to remove the tumor. Finally, come November, after harassing them, I got an appointment with the surgeon.
I got my 3 minutes in.
The surgeon agreed with me that it was very urgent that my father got surgery right away, because at this point my dad could hardly walk. He was vomiting in the surgeon's office. His skin tone, he's now gray. He lost a significant amount of weight. So the surgeon agreed it was a matter of life and death that my dad got this tumor removed. And he said he would directly admit my father into the hospital in a couple days when a room opened up. So I believe it was November 11th, the room opened up. We were excited. We got him to the hospital. We were told once he went to the hospital, he would have surgery within a couple. So he was there November 11th to November 19th. They never did surgery. Before he even went to the hospital, my dad, we used to joke that he was a negative Nancy because he would always think the worst possible outcome was going to happen, that the upcoming holidays would push back a surgery. I was like, Dad, that's not going to happen. I spoke to the surgeon about it. The surgeon said he wouldn't let that happen, that my dad needed surgery. So November 19th, he hospital, still no surgery. Doctor said, well, the holidays are coming up, so we're not going to do surgery. So if your dad wants to go home till the Monday after Thanksgiving, we can readmit him after Thanksgiving, and then we'll do the surgery. So since they wouldn't do the surgery, my dad was absolutely miserable there. We took him home. That was November 19th. November 20th, again, my dad's gray. Oh, and when he was in the hospital, his legs started swelling up because his tumor was wrapped around his iliac artery. Kept telling the doctor, you guys should probably do a scan on that. He said, oh, he's just cancer. That's why. Just blew it off. So when my dad came home, November 19th, about 8 o'clock at night, November 20th, my dad ended up going to the bathroom. A whole bunch of blood clots came out of him. The bathroom looked like a murder scene. He became unconscious. As soon as the EMTs got there, he became unconscious. He flatlined 2 or 3 times on the way to the hospital. They didn't think he'd make it through the night. He made it through the night. But the next day they told us that he was brain dead, that there was no brain activity. He was swollen like 3 times the size he was the day before. It didn't even look like my dad. And so me and my sister had to decide to pull the plug. I mean, he wasn't even just a couple months before that. They were saying it was precancerous cells. My dad was a machine. He was so healthy in every other aspect of his life. He had no other health problems. He shouldn't have died. They were totally negligent. They just kept pushing it off like he had all the time in the world.
Thank you, Heather.
Thank you for letting me speak.
Tough one, very tough. Belinda Warren.
Hi, my name is Belinda. My mother's name was Lillian. To all the House and Senate members, thank you for listening. I'm requesting that you hear me and listen to what I have to say. If we have a government meant to protect us, how then can it allow such harm? I have come to Tallahassee from Ohio 3 years in a row to fight for my mother's death. I came and spoke in the House last year when it passed. Please let the word I'm saying next be heard. No matter how gross the negligence, a doctor whom first takes an oath to do no harm can harm. And we, the human life, that the promises made have no recourse. So we have to pay, but the doctors and hospitals can sue for the bills. So we have to pay for our own deaths. Can you hear the blatant disregard here? The doctor did a procedure to my mother that should not have been done. All she needed was a simple MRI, and that would have sufficed. I expect someone to be held accountable for her life, as well as the protection from our government for such laws preventing recourse or cause of action. I'm one of thousands. The doctor did not do the proper test to make sure she had no plaque blocking her arteries before pushing 42 pieces of plaque into my mother's brain, causing 42 strokes and a massive seizure, this causing her to be brain dead. Can you imagine our suffering, pleading for answers, trying to get any doctor to explain to us, tell us what to do? 15 days she laid there before we let her go. So please understand why we fight so hard and with so much passion to have these bills heard and a fair chance to change a law so wrong for the people. My mother deserves her life to be accounted for. She was a mother of 5, 4 stepchildren and 30-some foster children and worked 3 jobs at times. She was beautiful. She was still having fun in her life, and it was well due her time. I was raised to believe in a fair justice. And as a woman, I don't expect anything less, especially not from our own governments, doctors, hospitals, police, human services, or anyone. I know what we could have been, what we should have been, and what we are. It's hard to believe for me that such a law could even be put into place. I don't understand how we're in that place that human life has zero value, either in prosecution or monetary settlement. It bears the question, at what point are we at? I am asking you to let the victims' families speak. What was taken from us is one of the greatest gifts life has to offer, our parents and our children. No person has a right to cut that short by mistake or purposeful intent. What if this is our only opportunity of life? I cannot tell you the pain I suffered and still suffer when I think of my mother's death. She suffocated senators and representatives. She gasped for air while she was dying. Her 5 children and siblings all witnessing her horrifying death. Her 5 children begging for her life or death, but not to let her suffer another second. I am not confused as to what is happening, but I am disappointed and ashamed that this is what any of us want for another. Please let us be heard. Thank you for hearing me. Belinda Warren, daughter of Lily and Eileen Gerber.
Thank you, Belinda. It was perfectly timed. Thank you. I have a, it's really beautiful. I have a request from Catherine to unmute your sister Rosie. And I see the number and I sent a request for her to unmute, but I don't have the power to actually, I can mute people, but I can't unmute them. So we'll need her to figure out how to unmute. I apologize for that. It's just not within my control. If you can't figure it out, Rosie, I would say probably a good option would be to drop off, to hang up and call back in, because when you call in, you're not automatically muted. So if you want to do that, when you come back in, I'll make you next. Lisa, I'm not sure if we have met. Would you like to speak?
Orello?
Orello, yes.
Yes, okay. Yes, we met once before and my sister was able to attend a meeting. She's the only one who lives in Florida. So, okay, I'll start now.
Thank you. I'm setting the clock for you now.
Okay. So, are we ready?
Yes.
Thank you for this opportunity to speak. I appreciate it. I've been suffering for over 16 years with my father's death. My father was, his name was Vincent Orello. He was everything to me. So I was 4 when my mother died, and so he was my sole parent. I never can get through this. He worked hard his entire life and he moved to Florida in 1974. And he was a World War II veteran. He had an aortic aneurysm and he was told to have surgery and he was really frightened about it, but I convinced him to go ahead and do it. I was worried about it, like a ticking time bomb. So he did finally do it. The surgery was successful, but they gave him this awful infection. It was horrifying.
Roseanne Parlay.
At Halifax Hospital.
Join the meeting.
They treated him like he was just an annoyance, that, they told me he was old and taking up an ICU bed. And I told them he walked into this hospital on his own 2 feet and he was supposed to leave. And none of us lived nearby him. So we had to take turns being with him. And the whole time I was there, I never got to talk to him. They had him sedated and intubated. The doctor laughed at him when he called a lawyer to make sure his will was, right. He acted like he was being melodramatic. My sister found out they weren't changing the arterial lines when they were supposed to. The week that we weren't there, none of us, he got sepsis and he died.
Babe.
And
sorry,
I never got.
You have 1 minute left still, but Rosie, I don't want to mute you because we had problems unmuting. but I'll ask that you just kind of, I don't know, cover the phone or something. Thank
Sorry.
you.
Okay, thank you.
Okay, go ahead, Lisa.
I just, he was finally at a point in his life where he was financially comfortable and he was having fun, and he was 82, but he could have lived another 15 years. He was in good health, and they just acted like, as I said, he was an inconvenience. I turned over the information to an attorney who said we had a case. The social worker told me that we definitely should have an autopsy because she had seen him a few days before and he was fine. And, the law prevented us from going any further. I didn't see the necessity for an autopsy if I couldn't get any legal remedy. So anyway, that was my story. He died in 2005 on the 4th of July.
Thank you for sharing that, Lisa. You did really good. Rosie?
Yes, can you hear me?
Yes, I'm going to set the clock for you for 3 minutes. I know you want to represent your family and your dad, I think.
Yeah, is there any way that you can unmute my siblings, so just in case they want to add something else that I may have missed?
I don't have the ability to unmute anyone. It's just the way the software works.
Okay.
If they can
Okay,
figure
no
out how to
problem.
unmute themselves, then that's okay, but I just don't have the ability.
Okay, thank you for giving me the opportunity to speak.
Go ahead.
Let me know. Okay, so my name is Roseanne Parley. I'm the daughter of Miguel Rivera and the youngest sibling of 5 children. My dad, date of birth was January 4th, 46. He basically, we're here basically to try to repeal that wrongful death act, because my dad was a victim of multiple negligence occurrences when he arrived at the hospital. My dad was sent to the emergency room via ambulance on January 20th of 2021. He ended up being admitted for cardiac arrest and respiratory distress. He was a 75-year-old man. He was completely mobile. He basically was very independent, and immediately, we got a call that he was in ICU, unresponsive, and all of a sudden he was there quite some time. Anyway, so he was there for a while, and we basically, I would call multiple times, keep my family informed, and we got the call from the physicians stating, oh, we limit our calls to 1 call. That was one thing. And I asked after several weeks, it was a couple of weeks, I kept asking, are you rotating my dad? Are you making sure he doesn't have any ulcers? Making sure he's okay. And after 4 weeks, going on 5, I think it was maybe 6 weeks, we realized that one of the nurses told us, oh, he does have, it's just a scratch on his bottom and it's nothing big. And I said, okay, finally I got in there, and finally I was able to actually see this, and this was at the very kind of like weeks down the road. It ended up being so necrotic, and it was kind of in the sacral area. And I stood there watching because I wanted to see for myself, because there was so much negligence. And to this day, we still don't have those reports of the wound and the pathology reports. On top of that, there was another incident where my dad had pulled out his IVs. He pulled them out, and he told me a couple days afterwards, after that had happened, that he was having pain. I had called because I couldn't get into the hospital. I kept calling and calling, speaking to the AOD, speaking to a nurse, trying to find out.
We're down to about 30 seconds. I'm not trying to rush to be rude or anything.
Yeah, no, that's fine. So he was on cardizem, and I just wanted to let you know that he was basically neglected there, and they didn't give him any medication till the next morning. I put a report in AOD. We've been in contact with the Joint Commission. I have 4 siblings and myself, my mom, under complete distress. a lot of suffering. The Foley catheter was pulled out, and that caused him to get on a urinary irrigation, which caused him a major infection. He had to be on dialysis afterwards because he had. It was just one thing.
I don't want to cut
after
you
the
off.
other.
I don't want to cut you off, Rose, because I know you got a few seconds left, but I just wanted to say that we did an autopsy report, and the autopsy report basically says what my sister was saying about my dad's death. And it's messed
He
up
was
because,
septic, and yeah.
All the effort that she put in there, my sisters and everybody, and still they even the doctor didn't even had the audacity to call the one that took care of my dad. He didn't even have the audacity to call my sister and say your dad passed away. Nothing like that. He was just gone.
Hello.
Still here. Does anyone else from the Rivera family want to speak while we are all together? If you are able to unmute yourself.
One thing I wanted to add. We were there, and his blood pressure was dropping, so we kind of like knew, but he never called. The physician never called us. I knew because I was on the portal every single night, 3 in the morning, 4 in the morning, 6 in the morning. I was on that portal all the time, being an advocate for my dad, because honestly, you cannot just let it go. I mean, they will not pick up the phone to tell you, oh, this is the status of your dad, or this is how your dad's doing today. So it was us being the advocate, and they tried to keep pushing, oh, why don't you DNR your dad? Just DNR him. And he kept telling him he's not a DNR. We want to do everything that you can do to help him and give him that chance in life. But it was a big struggle. So I just wanted to, thank you.
Thank you, my sister. I love you.
Thanks. It's not easy, and I hear a lot of similar situations, that I have been hearing of different cases that are so similar. And please, I would greatly appreciate we all just act together and be a team. And I wish the best, that they can do something about these bills. Thank you.
This was our dad.
I want to make sure I call on the next person. Dominic, do you want to begin, and I'll set the timer for you.
Yeah. Okay. Can I say straight to Senator Danny Burgess?
Absolutely.
Okay. Well, I would like to direct Senator Danny Burgess directly. My name is Dominic Phillips, and I'm here to tell my story about my mom, Tracey Montagnino. She went in for a scheduled hernia and minor gallbladder surgery on October 27th, 2021. She was discharged later that day. The next day, she was complaining about stomach pain and couldn't pass her stool. So she went back to the hospital, and she was in the ICU for 3 days. There, she was given morphine for the pain, IV fluids, and iron. They were supposed to give her a blood transfusion, but never did. They said they were going to schedule it later that week. As soon as she was able to pass her stool, she was sent home. They never checked on her surgery. I picked up my mom on November 4th at 4 p.m. Saturday, November 6th, I saw my mom at her apartment. She seemed to be doing okay. The next day, Monday, November 8th, she was dead. The detective on scene ruled it a heart attack. Obviously, we were not happy with that, so we had a private autopsy performed. They called me later that day after the autopsy was performed, and they said my mom should still be alive. For whatever reason, the surgeon forgot to properly seal her ducts after the surgery. She had a bio leak, she went septic and died, totally preventable. Someone made a mistake that cost my mother her life. And I can't do anything about it or hold anybody accountable due to statute 768.21, subsection 8, better known as the Florida Free Kill Law. This surgeon is able to keep his license and possibly kill somebody else again. I think it's important to know that I found out about this law the hard way, like most of us do. The only reason I believe this law still exists is because not enough non-effective Floridians and constituents know about this law. There's a difference between knowing and caring, and not enough people know. All Floridians are going to know about this law. So please, I ask you, help us stop medical murder. Please hear Senate Bill 626, Senate Bill 560. Help repeal the Florida free kill law. Help save the community and Floridians you say you care about.
Thank
That's
you.
right.
Really well said. So I'm trying to navigate who else hasn't spoken, and we have a lot of windows and numbers open here. So I think who hasn't spoken is Crystal, Catherine, Carol, Denise, but I don't know which of you are also speaking together with other people. So
I'm Crystal. I am not speaking with anyone.
okay, then you may have the floor, ma'am.
Okay, I'd like to thank everybody for this opportunity so that I can speak for my mom, Karen Munsey. She was 82 years old, mother of 4, grandmother of 10, great-grandmother of 14, and a great-great-grandmother of 4. On April 4th, 2020, we celebrated her 82nd birthday at my home with a dinner and family. She climbed up the 17 stairs and back down when she left. On the 9th, she was admitted to Manatee Hospital for a urinary tract infection, back pain, and confusion. When they took her list of medications, she'd been on Prozac for 20 years and they refused to order it, saying, "We don't do that." She had an IV started on antibiotics and seemed to be improving the next 5 days. She was up walking in the hall with physical therapy, eating and drinking, and discharge was around the corner. On April 14th, during the night shift, they assisted her to the bathroom and she fell. She was a fall risk and they did not follow their protocol. She did not have her shoes on. She did not have a gait belt. She was found to have 2 breaks in her left foot and she had a lot of knee pain. We were given no explanation. And when she said she fell, a nurse said, "No, you didn't fall. We caught you." But I have photographs of her foot and both of her knees where they were scraped up where she did fall. We were told that she just needed to go to rehab, but she kept complaining of different things. We never got to talk to an attending doctor. We only spoke to the resident. She complained about the knee pain and we were told it was arthritis. She complained about bloating of her belly and they said she was constipated. She complained that her left leg didn't feel like it was attached and often fell off the bed. Again, we were told she just needs to go to rehab. She one day looked at me and said, "You are a good nurse. And if you don't get me out of here, they're going to kill me." The day came where she went to rehab. Within 12 hours of going to rehab, they listened to her complaints and they did a bladder scan, realizing that she was unable to empty her bladder and there was 1,400 cc's of urine in there. She then got a Foley catheter. After, they were never notified about her broken foot. That was always swept under the rug.
Down 1 minute.
That information was never given to them. After 4 days, she was unable to rehab. They sent her to another hospital. We did find that they repeated her CT scanned and she had severed her spinal cord. Had the first hospital done that, they would have found that out and she would not have been in pain for those 3.5 weeks. I took her home. I did hospice care and she died 4 days later. This law discriminates against all single people, including myself. It needs to be repealed. I beg you to please listen to us. Thank you.
Thank you. And the elderly are some of our most vulnerable population, right?
Yes.
Thank you for sharing. Encourage you to come to
Donald?
our regular meetings too. We do have a lot more sharing without time limits in those meetings every other
Okay.
Thursday.
This is Catherine.
Catherine.
Yeah, that was my family, the Rivera family, Miguel Rivera.
Okay.
Yeah, so we already spoke.
Okay, thank you.
Thank you. And we gladly appreciate everything you're doing and for letting my family speak. And so sad, all these stories.
Thank you for joining.
Thank you.
I just wanted to say, I just wanted to add to that, Melody. Thank you for everything that you're doing, you and Belinda and everybody else. I mean, I can listen to everybody's stories. I can't imagine what the future will look like if you guys don't step up to the plate like you're doing. And just please keep informing us and let us know what we can do to help you. And
This is big tonight because we're going to try and get all of this in this video tonight in front of all the legislators. We have the pathways to get it to them, and we just want everyone to be heard, and we want them to realize that there are a lot of people suffering and there's a lot of lack of accountability where, you know, people should be held accountable, and that it's not just the four of us who went to Tallahassee this year or whoever went last year, that there's a lot of people here. And so that's, we really just want this to be your testimony to them.
Thank you.
Thank you. Who have I missed? Anyone that still needs to speak? Mary Jo, I think you texted me that you wanted to try and go last. It's okay if you can't.
Yes, ma'am. Okay, so it's very emotional and I get emotional listening to all these stories. So it's really hard, but I'm going to try to get through it. Anyway, hi, I'm Mary Jo Kane Reese, and I'm here on behalf of my dad. My dad had a stroke on October 10th, 2019. Dad was rushed to Holmes Regional Medical Center where they performed a thrombectomy, which turned into a hemorrhagic conversion. After the surgery, the doctor came out and said, "I'm sorry, I caused a hemorrhagic conversion." And at that point, I had no idea what that was. I was never involved in the medical field. I was involved in the legal field. Anyway, after the surgery, they heavily sedated my dad. They intubated him and basically knocked him out. He laid on his back for 30 days at Holmes Regional Medical Center. We were sitting at his bedside in the ICU, and we noticed that no one even attempted to move this man. He laid in the same position, no physical therapy. We had to push for a feeding tube on him because he would have died just from malnutrition or whatever. Anyway, after 30 days, they started approaching me saying, "We got to get rid of your dad. He's got to get out of here." Okay. I said, what are you talking about? I mean, where do you want me to put him? "Well, we have a long-term hospital you can go to. It's called Kindred in Melbourne. It's a long-term hospital. They'll give him rehab and therapy and he'll, get better." So we did that. We moved him over to Kindred. We were there at his bedside. I have 5 siblings. We all were there for him. He was never left alone if we could help it. At that hospital, they never moved him again. But when I would come to the hospital, everybody would scatter and act like they're doing something, okay? They weren't doing anything. But anyway, lo and behold, he was there for 90 days. After the 90 days, we had to find a rehab center. They said they were kicking him out. The insurance doesn't want to pay anymore. So we sent him to another place, this Vieira Del Mar. It's a rehab center. And by the way, when they say rehab, I don't believe that there's ever a rehab center. It's all baloney. They don't rehab anybody. They put these people in these beds. When you're there, they act like they're doing something. They really are not doing anything. So when I hear rehab, I want to cringe. Anyway, I was at the facility the 3rd day he was there. I arrived, he was delirious. He's calling out for help. I felt his skin. He was burning up. I called some guy down the hall and I said, "Have you looked at my dad?" And he said, "No, I just thought he was talking to himself." I'm like, "Excuse me?" He's delirious. He was calling for help. You could hear it vividly. Help. Anyway, we called 911. His fever was 105, by the way. We rushed him to Cape Canaveral Hospital, which is right where he lives. He lived in Cocoa Beach, in Brevard County. Cape Canaveral Hospital did a bunch of tests. They let me in the room. They showed me his back, his coccyx bone. He had a bed sore as big as a hole where you could put a golf ball into it. Okay. The result of Cape Canaveral Hospital was he had sepsis, he had pneumonia, and he had MRSA. He had 3 things going on. Okay. This was mind-boggling. They treated him immediately. They treated him very well at Cape Canaveral Hospital, I have to say. Anyway, during the course of this whole dilemma or this horrible situation, I talked to medical people and they said, hey, don't worry about it. Later, you can do something. You could sue these people. You can do whatever you want. So I always had that in the back of my mind thinking, well, I want to worry about my dad right now and get his health back, and then we'll go after him later. Okay. So later comes, my dad died almost a year after his stroke. And I spoke with an attorney who told me, yeah, your dad is a victim of gross negligence here. You have a grave case. I assume you have a mother, right? I said, no, I don't have a mother. My mother's dead. My dad's, no, he has nobody. It's just us. He said, well, you're over 25, obviously. You can't do anything, ma'am. You are just, there's nothing you can do. Okay. So I said, how could this be? I can't hold people accountable that are the reason for my dad's demise. No, you can't. I'm sorry. Our hands are tied. What you need to do is you need to look up statute 768, 2.1, subsection 8 and read that. At that point, I knew it was the end. I mean, there was nothing we could do. In my opinion, I'm sorry for crying.
Oh, you're fine.
In my opinion, this is justice denied. We hear all over the United States, people want justice. We are crying out for justice for our victims, our fathers. How could someone let this happen? These are blatant, gross, and negligent cases. Why is this happening in the year 2022 in the United States of America? My dad was an Army veteran. He loved his country. He thought the world of this country. God only knows. He obviously doesn't know what happened to him at the end of his life, but this has to stop right here and now. This law has to be repealed. It is archaic. It is nonsense. I am tired of these insurance companies, these medical malpractice lobbyists. They don't care because they weren't affected, but I bet if they were affected, they'd be changing this whole thing. So we are going to continue to fight till our last breath so we can make a change for the future of the state of Florida. A lot of people retire there. I personally live in Chicago. I visit Florida frequently. I know several people that I've educated now. You're moving, you're retiring to Florida, you better look at the law. If something happens to you and your wife is gone or your husband's gone or your children are under or over 25, you can't do anything. Basically, also, I must add, a doctor could lose his license in Chicago and go out to Florida and practice medicine. What is going on here in the state of Florida? It's ridiculous. And again, till my last breath, I will keep fighting for this. I want justice just like everybody else. Thanks for listening. And Senator Burgess, you need to get this on the agenda. Put it on the agenda. The Judiciary Committee needs to hear these bills. I don't want to hear any excuse. I don't care what you say. This is our legal right as United States citizens. That's all I have to say. Thank you for listening and good luck to all of us because I know we're going to be victorious eventually. Thank you.
Thank you so much.
God bless you, Mary. Thank you for sharing that. I know it was hard, but
it was.
We're gonna make a big impact, and every we got to get a lot of people on board and make a big, humongous impact on what's going on, and then they'll start listening.
They will. This is the thing, though. I find
I'm going
unless
to
you're
end the recording right now, and then we can keep.
Oh,
talking.
okay, yes.
I want to end the recording so we can have private discussion. I want to real quick thank everyone because this is the hard stuff, and ask that the legislators who've listened to this video to please take action. This is not the only group that we're going to testify with. We have people who couldn't make it tonight that I promise we'll arrange another date for. And we're going to keep doing this and sending you our stories, because there are thousands of stories have come across this Zoom room. This is just a very small representation of what's happening out there. So I'll end the recording, and then Mary Jo, go ahead.